I'm going to try and do a really basic, kind of crude explanation of what in vitro fertilization is. In case you have no idea, here's how I can explain it. So every month you have an egg, or every cycle, maybe every 28 days or so, somewhere in that cycle, one egg from one of your two ovaries will release and travel down the tubes into the uterus, where it has the potential of being fertilized by sperm and becoming an embryo and a baby. The idea of IVF is you have in each ovary a lot of follicles. So follicles are the start of an egg, basically. And so a young person, like very young, let's just say your optimal maternal age, the age where it's the easiest to get pregnant would be like early puberty, basically, or 17, 18, around those years. But let's just say someone in their early 20s will have a lot of follicles in their ovaries. They will probably have 30 and up. That number starts to decline around the age 30, number of follicles in your ovaries. It takes another steep decline around 35, and then a very drastic decline around 40. So a woman is born with the most eggs she will ever have. You do not basically recreate new eggs. You have a certain number. You're born with hundreds of thousands of eggs, and all it does is just go down every day, every month of your life. So when you reach menopause, it's basically you're out of eggs in your ovaries. There are no more follicles. Things are, very smaller. The number's too small to get pregnant. So in IVF, the idea is to recruit all those follicles, stimulate them, make them into eggs, an unnaturally high number. So something that would never happen without the use of hormones. So you take different follicle stimulating hormones to grow your ovaries. They get a lot bigger than they naturally are. And the idea is to get a whole bunch of eggs out. So you go through a stimulation process. Sometimes you precede the stimulation process with downregulation, which I'm doing now. So that's a long protocol. It takes a lot longer. It's like 5 to 6, no, maybe not. It'll be like 4 to 5 weeks, whereas a short protocol is a couple weeks, about 12 days. 8 to 12 days of stimulation, and then egg takeout and things like that. So the idea is to give yourself shots to stimulate those follicles so that they grow to a certain size. I think the optimal size is 20 to 24 millimeters. Once they get too big, they're gone. But they want to get as many as they can. It used to be they would try and get out 30 plus, and nowadays they've scaled back and they realize that quality is compromised if they get too many follicles. So the ideal number at our clinic would be like 8 to 12, 10 to 12 perhaps. A lot of clinics in the US might shoot for 15, between 10 and 15. But the idea is to get as many out, or to stimulate them. They measure you while you're doing the IVF stimulation protocol. They measure by doing a vaginal ultrasound. So they see on the screen how the follicles are growing, and they'll say, oh, on your left side you have 7 or 8 that look to be growing the right size, and the other side there's 6, 7. So you try and get, a good number out. When you're older, a lot of women I know who are in their early 40s have not a lot. They might have 3 or 4 follicles total. I'm averaging around 8, which isn't bad. It's not amazing, but it's not a bad number actually. The idea is to stimulate them, and then they schedule an egg retrieval. Once they all grow, with the goal of growing at an even size, so you don't have a lead egg that's like way ahead and then some are way behind. So to evenly grow them is the goal, and then they schedule an egg pickup day. So based on the size and measurements, they can say, okay, in 3 days we're going to do egg pickup. And what that involves is, again, a vaginal ultrasound. Some clinics you might use a speculum. So in some ways it kind of starts as like a pap smear. And then they retrieve them with this called aspiration, actually. So it's a tiny needle that goes into your ovaries. So they start off by just going in with this ultrasound, vaginal ultrasound, and then a needle shoots out of this thing, goes into your ovary, and it's in there, and the idea is to aspirate and to suck out the little follicles. And the follicles are kind of big. I mean, they're 22 millimeters. Give or take. So they just kind of suck them out, and it does hurt when they suck them out. Here in Denmark, they don't put you to sleep. I actually think it's very good that they do that. It helps the recovery process. In the US, you're often asleep when they do this because it is uncomfortable. In Denmark, I don't think it's that bad because they give you morphine and you're like, ooh, you're totally like doped up on drugs. So this is the process of sucking the eggs out on both sides. So there's 2 little perforations into the ovaries. So they do left side and right side if you have 2 functioning ovaries. Some women may not, and then they just get out what they can. And then there's an embryologist who receives the eggs instantaneously. They look at them and they do either natural fertilization, which would be pure IVF, or they do ICSI, which is micro insemination, where they take a good sperm that they can find and inject it into the egg. And that procedure is very important if you have poor sperm quality. So we've done that sometimes, but we haven't had to because Martin's sperm's pretty good. That's the process, and then they watch them. They're on a dish. The idea is the next day it should have fertilized, and by day 2, you should be around 4 cells. So a normal egg that's fertilized should start dividing. And they want it into, first it goes to a 2-cell, and then a 4-cell, 8-cell, and then so on and so on. The way we've done IVF, we transfer very early. We transfer on day 2. So you may hear terms like, I'm 5 days post day 3 transfer. And in the US, they usually transfer on day 3 or day 5. By day 5, if you have an embryo on day 5, you're pretty lucky. And that is called a blastocyst. And those, if they have good quality, and they look at quality scores by fragmentation and size and symmetry, they all cells look similar size, and there aren't little things poking out of it. That's called fragmentation. You don't want that, because that could mean it's an aneuploid egg that in dividing it lost some chromosomes. That's not a good egg or a good embryo. But they score them along the way. And we've done one day 3 transfer, but at the public clinic here, they always do day 2 transfers. They believe an embryo does its best in its natural environment, so they don't like hanging around till day 5. But at our last transfer, we had a day 3, which means we had egg pickup on a Tuesday, and then on Friday they transferred back. And that was 2 embryos that were not optimal size. They were behind. They were like a day 2 size, and that's not a good sign. That means that there's a problem with the embryo. So in short, that's how it works. So you get a transfer back, and that's a pretty simple procedure. It's much like an insemination. It's uncomfortable because you have to have a full bladder, and then they stick a catheter in and they place the embryos in the right space in the uterus for ideal implantation. And then you begin what they call the 2-week wait. And then 2 weeks after that date, you go in for a blood test, and they see if you have something called beta HCG, which is the pregnancy hormone. So that 2-week wait can be very grueling. You take progesterone to delay your period and to help make it a more fertile environment for implantation. And so we've done that several times. We've had on rounds 3 and 4 of IVF, we did not have any transfers. So we went through everything: stimulation, growing them, egg pickup, and even with 8 eggs taken out, by day 2, all of them had died or looked terrible. So that's when we knew we had a real problem. So I have enough eggs and something should be happening to them, but they don't do well on the dish. So that's one of the things we are struggling with. It is extremely difficult to go through a round of IVF and not get anything out of it. I would say that the reason why I have survived many rounds of IVF and am okay and getting by is because I'm in Denmark, actually. And the way they treat it here, it both makes me mad sometimes, or it makes me shocked. At other times, I just feel extremely grateful that I am in a country that treats IVF like going to the dentist. It's really just a low-key affair. Not that they don't do things the right way. They do everything by the book, normal, up to standards. But the emotional element, the psychological element, is very much like, you got this. Let's not worry about it. Let's not be overly sensitive. Let's not make a big to-do about this. There's not a lot of fuss involved with IVF here. It's like, just get it done, do it, boom. Don't talk about it. You're fine. Again, this is the country of Vikings. It's so funny to me. This place is so stoic sometimes. It's just like, don't fall apart. You're okay. And that has absorbed my mentality. And I got this. I'm not going to make a big fuss. I'm not going to come home crying every day. I got to go to work. I got a job to do. So the only time I've ever missed work during IVF is the day of egg pickup. Because you are on anesthesia, they give you a little propofol, and it's the Michael Jackson drug. I always laugh about it. I'm like, I'm getting that drug. It's actually a very good drug. So I get that plus morphine, and then you have to recover for the rest of the day. You're kind of drowsy, and so you just take a nap, and you're sore. It does hurt a bit. The egg pickups, and women who have 25 eggs in there or 25 follicles, that hurts. You are in pain because they suck them out and then they fill up with water again. So they're draining that little follicle, removing the egg, and then the follicle's left behind with water in it. So you get bloated and it's uncomfortable and it kind of hurts. But all that aside, I have not missed much work, and I have kept very focused with my eye on the prize. So in that way, I love Denmark for not coddling me, and they're not sitting here going, oh, are you okay? It's like, you got this, you're done, you're in and out. Like, it's just very rote. It's just routine. Let's just get this done. I'm really actually grateful. And I think if I was in California perhaps, and I let the emotions get to me, and I had so much sympathy and drama, and I think we are a little bit dramatic in the US sometimes in just the way we approach everything. I love that about our country. I'm a total drama queen at heart. But I don't think that would help me in this situation where we are completely desperate and where we need to keep going and we need to move ahead at full speed and we need to just survive something that's pretty traumatic. IVF is pretty hard, actually. When you think about what you're putting your body through, it can be quite exhausting. Being on the hormones, it's never that fun, but I can say that some of the drugs I've done very well on. A few of the drugs, like Puragon, I don't really love that one. It can make me a bit more emotional than normal. But for the most part, I've done okay on the stimulation. I know women who've been on Clomid in the US, and they think that's like the worst. I really think that's like a drug that can screw with you mentally. And it's just not fun to be a person who's struggling with her fertility, to want a baby so freaking bad, and then be forced to take these drugs that really screw with your mind and make you into this person that you don't feel like you are. Like, you're just more emotional, you're bitchy, you're just irritated with your husband or spouse. It's not fun. Thankfully, I've been on some drugs where I can tell my husband, listen, you got to cut me some slack right now. I'm going to be a little emotional or moody, and he does. But I do notice, like, if we ever argue or have disagreements or I'm being a little unreasonable, it's usually I'm like, it's because I'm on hormones right now, and that's the only reason why we're bickering. That's IVF in a nutshell. That's where we have been. If you have any questions for me, you can post them below. Thank you so much for watching, and I hope to see you again. Bye!